Dr. Gainor is a rare find in New York City. He is thorough, he takes the time that you need, and in a city that is just hustle and bustle, when you find him, it's like, aha, this is what a dental practice should be.
My name is Dr. Marc Gainor. I've been in practice for 32 years. I was born and raised in New York, and I love practicing in the heart of New York City.
I've been a patient of Dr. Gainor's since he took over the practice of the previous dentist I had gone to. Now, I look forward to coming here because Dr. Gainor is absolutely painless. When I lie in the chair, I could practically fall asleep.
And he did this big 2.5-hour workup, total comprehensive exam of my mouth, and I'm like, just fix my tooth. And he said, I have to know about your total mouth first.
Comprehensive care is not only looking to see, for instance, what fillings they may need, but also evaluating their function, evaluating their aesthetics. We spend 2 to 3 hours evaluating patients comprehensively and then come up with a plan for life. Not a plan that's just taking care of fillings, but addresses all of the issues that we see.
He went through everything with me, showed me all the x-rays, showed me all the photos, and all of a sudden I was enlightened. I said, oh, this is what's wrong. This is what's going on.
I'm very happy to come here, and everybody knows me by my first name, and I feel like I'm visiting a bunch of friends.
My staff is very well trained, and I'm very proud of them.
I like working with a great team at Dr. Gainor's office.
Here at Dr. Gainor's practice, we really try to make our patients feel comfortable. When the patients walk in, I usually offer them a cup of coffee, something to drink, take their coat for them. I really want them to feel at home, like they're walking into my living room.
Dr. Gainor's practice, his office, his staff, create such a welcoming, warm atmosphere that when I come in, I actually enjoy going to the dentist. I know that sounds weird, but I love my experience every time I walk into Dr. Gainor's office.
When patients come to the dentist, oftentimes they feel anxiety and stress related to that, so it's our job to keep them comfortable and make them feel at ease in our practice.
We have new technology in the office that makes the dentistry more comfortable and easier for patients. We have a laser cavity detection system called the Diagnodent. We also have lasers that we use to treat inflamed gum tissue and access decay below the gum line. We have electric handpieces in the office that are a lot quieter and make things much more comfortable for patients. When patients don't hear the sounds of the drill, they feel much more relaxed about it.
Dr. Gainor's patients like him, but more importantly, they feel like they trust him.
I do consider myself a continuing education junkie. I spend a lot of time not only teaching, but also taking courses. I've given courses in bite, as well as restorative dentistry, as well as TM joint discomfort. I enjoy educating my patients about bite and bite issues, as well as teaching other dentists around the country about bite, which I do regularly. I find there's so many changes that have occurred in dentistry and in technology that if you're not constantly taking courses and constantly working to improve your skills, that you're behind the times.
I was born with a dental condition called ameliogenesis imperfecta. This is the before of my teeth. As you can see, there's a lot of pitting, and the teeth size are a lot smaller than most normal adult teeth. Dr. Gainor was the first dentist to diagnose me with ameliogenesis imperfecta, and he was the first dentist to offer me a treatment plan that didn't include dentures. And this is the after, and now you can see why I love to smile.
For me, dentistry is like art. I've transformed a number of my patients' smiles, and it's really changed their lives.
Maybe I show too many teeth, but I have a good smile. Thanks, Dr. Gainor.